So what are the possible treatment and strategy in autoinflammatory diseases? So it's not always, and more often, it's not possible to cure the patients, but we can do the minimum. And one of the minimum we can try to do is to make the symptoms disappear. And in general, as these diseases are basically inflammatory, we can use not specific approach using NSAIDs, colchicine, or steroids, for example. Even these latter are not usable for a long time because there are too many side effects. If it is available and if we have more knowledge on the pathway of the disease, we can trigger specifically some cytokine, for example, and you can use more targeted biologicals or small molecules. So this approach really has demonstrated that we can improve the quality of life of the patients, and we can also lessen organ damage. But in this case, supportive care is still needed because really we cannot cure the patients. So there are other approaches, and here the main aim is to cure the patients, and it has been done in some rare diseases. And one approach which is available is hematologic stem cell transplantation in some cases. And also gene therapy is something available, so not directly in systemic autoinflammatory diseases, but it will be available, and there are some plans, to my knowledge, at least for mevalonate kinase deficiency. And the aim is to replace the defective gene by a normal gene. You can also repair or eliminate a gene that is not functioning, or not functioning good, or functioning too much, and there are some techniques to do that. And we can also modify the RNA, the messenger RNA, using antisense nucleotides. So technologically, it is feasible. It needs some improvement, but it's something that the patient can really expect for the next coming year. But of course, it is just accessible for the disease which are clearly monogenic. We need to identify the causative gene for making this type of therapeutic approach possible. And also we have to, of course, to have the availability. Also, we have to assess the safety. It's high cost, so for the moment, it will be restricted to selected patients. So this is an example of the therapeutic targets for monogenic autoinflammatory diseases. If we cannot cure the patients, we can relieve the inflammatory symptoms. And you'll see here the different types of autoinflammatory diseases. We know the inflammatory pathways, so we can target the pathways depending on the group of patients. We can block the IL-1, we can block the interferon, we can block the TNF. It depends on the type of the disease, and it is something that is at this time very effective in a lot of these diseases.